Hello, my name is Judy Moreno. I'm an FNP student from Simmons College and I will be doing your physical exam today. How are you?
I'm good. How are you?
I'm very good. Thank you for asking. So I've already conducted the health history of this client. This is Ben. He's 34-year-old Filipino male in no acute distress. He's 5'7" tall. He's 170 pounds. He's medium framed. His temperature is 98.6 degrees Fahrenheit by mouth. His blood pressure is 120/80 on the right sitting. His pulse is 72 beats per minute and regular, and respiration is 16 and non-labored. All throughout the interview, I made note of his affect, which is variable and appropriate for the occasion. I also made note of his outfit, which is appropriate for the weather in Baltimore and appropriate for this occasion. I made note of his personal hygiene and grooming. It is neat and clean. His posture is erect. His manner and facial expression is variable and appropriate for the occasion. And for this video, for the sake of this video, I'm going to ask you a couple of questions. Do you know where you are, Ben?
Yes, I'm at my home.
Very good. Do you know what today's date is?
Today is November 16, 2017.
Do you know who the current president is?
Yes, the current president is Donald Trump.
Very good. Thank you. Moving on to the actual physical exam is starting with the skin. I'm going to check the skin on your forearm. It is brown. It is smooth and dry. There is no excessive moisture. Same thing on the other side. It is brown, smooth, and dry. There is no excessive moisture. There is no hypo or hyperpigmentation of the skin. There is no lesion or any bruising or erythema on both sides. Looking now at the skin on your face, it is brown, it is smooth, there is no excessive moisture or any excessive drying on the forehead or the cheeks. I note that there is a linear scar on your left forehead about approximately 3 inches long. And I also note that there are some drying in the nasal labial folds. I also note the same drying on the eyebrow. I'm now going to check for your nails. Very good. The nails are clean and short. It is pink. The capillary fill is brisk and it's less than 3 seconds. There are no cyanosis, pallor, thickening, ridging, or any abnormalities of the nail. I'm going to check for your scalp. The scalp is white to pinkish in color, which is appropriate for the client's skin tone. I note that there are some dryness and flaking on this side. I'm going to check on the other side. The scalp is white and pinkish in color. There are some drying and flaking on this side. I'm going to check for your hair. The hair is black. It is shiny and smooth and it's clean. It is thick and curly. There are some graying of the scalp. There are no any thinning or any obvious infestation. Moving on to the examination of the eyes, starting with the eyelids. The eyelids are firm. The upper eyelid rests on the superior borders of the iris, and the lower eyelid rests on the inferior border of the eyelids. And from this, I can make the assessment that the palpebral fissure is of normal size. I'm looking at your lid margins. It is firm without any inversion, eversion, erythema, or any edema or any lesion. And I'm now looking at your lashes. They are black. They are outward pointing. There are no any inversion, eversion, or any infestation or thinning of the lashes. Looking now at the conjunctiva, starting with the bulbar conjunctiva, it is shiny, is smooth, and translucent. There are no any lesion or any abnormal markings. I'm going to check for your palpebral conjunctiva. I'm going to pull down. It is pink. There are no injection or any lesion on the palpebral conjunctiva. I'm now looking at the sclera. The sclera is white. It is non-ecteric. There are no obvious yellowing or any lesion of the sclera. Now going to look at your cornea. The cornea is shiny, it's smooth, it's translucent, and it's moist. There are no obvious arcus or any lesion of the cornea. Now looking at the iris, they are brown, round, and regular. There are no blood or pus in the anterior chamber. There are no obvious lesion or any edema. Looking now at the pupils, they are equal. They are approximately 3 millimeters in size bilaterally. They are round and regular. I'm going to check for the pupillary response. I'm going to shine the light on your left. And the pupils constrict on the left side as I shine the light on the left. I'm now going to check for the right. And the pupils constrict on the right while I shine the light on the right. I'm now going to check for the concentral light. I'm going to shine a light on your left while I observe the response from your right pupils. And the right pupils constrict while I shine the light on the left. I'm going to do the same technique on the other side, shining a light on the right while I look on the left pupil. And very good. The left pupil constrict, and this is a positive sign of the direct and concentral response. I'm now going to test the accommodation response. I'm going to have you look from an object from a distance, and I'm going to put an object in front of you. I need to change your focus and look at the object. As I bring this closer to your nose, I note that the pupils constrict and the eyes converge. Very good, and it's a positive sign of the accommodation response. Moving on to check for the extraocular movement, to check for the cranial nerves 3, 4, and 6. I'm going to have you follow my hands, okay? I'm going to make an H. Very good, very good, very good. And the extraocular movement is intact in the 6 cardinal fields of gaze. There are no signs of strabismus or nystagmus. The cranial nerves 3, 4, and 6 is intact. And I'm going to check for the visual acuity. Using a handheld Snellen chart, I'm going to have you hold this 14 inches away from your face. I'm going to have you cover your left eye. Can you please read the lowest line that you are able?
LTFPH.
Very good. Same thing on the other side. Cover the other eye.
LTFPH.
And both eyes uncovered.
LTFPH.
Very good. The visual acuity is intact. It is 20/20 OS, 20/20 OD, and 20/20 OU uncorrected using a handheld Snellen chart 14 inches away from the face. Moving on to check for the visual field. I need you to look at me. This is the check for the cranial nerves 2 again. I'm going to have you cover your right eye while I cover my left eye. And let me know when you see my hand come in your visual field.
Yes, I see it.
Very good.
I see it.
Very good.
I see it.
Keep your eyes covered.
See it.
Very good.
See it.
Very good.
See it.
Now, the opposite eye, cover it. And while I cover my right eye.
I see it. I see it. I see it.
Keep your eyes covered. Keep a look at me.
I see it.
Very good.
I see it. I see
Very
it.
good. And the visual field is full by confrontation. Moving on to check for the Fundus Copic exam. I'm going to dim the light. I'm going to come in a 45-degree angle. I'm going to grasp your lid. I note that the red eye reflex is intact. The lens and the vitreous are clear without any obvious opacity. I'm going to go check on the other side. I note that the red eye reflex is intact. The lens and the vitreous are clear without any obvious opacity. I'm now going to check the retina. The retina is pink. There is no hemorrhage or any accident or any AV nicking. The arterioles are bright red and curving. The venules are darker red and straighter. The artery to vein ratio is 2 to 3. There are no AV nicking or any lesion or any exudate. I'm going to check the same I'm going to do the same technique on the other side. The retina is pink. The arterioles are bright red and curving. The venules are darker red and straighter. The artery to vein ratio is 2:3, and there are no AV nicking, no hemorrhage, or any exudates. We're now going to check the optic disc. The optic disc is found medially. It is round and regular. The physiologic cup is in the center of the optic disc. It is round, regular. There are no edema or any lesion or any obvious cupping. Okay, same thing in this side. The optic disc is round and regular. The physiologic cup is found in the center of the optic disc. It is 1/3 the size of the optic disc. There is no lesion or any abnormal markings or any cupping of the physiologic cup. And this concludes our physical exam.